get to
How many tests did you do yesterday?
So yesterday, over 18,000 people were tested.
18,000. So you've got 8 days to get from 18,000 to 100,000 a day. You're not going to do it, are you? In fact, you're not going to be anywhere near it.
So that's against the capacity of 40,000
I don't care about capacity. The Health Secretary assured us 100,000 people a day would be tested by the end of April. I don't care what the capacity is. That's your job, is to make sure the tests get done. 18,000 yesterday is nowhere near 100,000. What happens when we get to the end of April and you've become woefully short of that target? Where's the accountability?
So, well, both capacity and the number of people actually taking up tests does matter, because if we don't have the capacity, we definitely can't hit the 100,000. So we both need to have the capacity to do the test and have people going forward.
He promised 100,000 tests would be done a day. He didn't mention capacity. It's 100,000 tests would be done a day. Was he lying?
Yes, but the capacity mattered, because before we couldn't do more tests.
Yeah, I'm more interested in the number of. I want to know if the Health Secretary is going to meet his own target that he used as a distractionary tool to change the agenda from criticism of the government to a positive. We're going to be testing 100,000 people a day by the end of April. It is now April the 22nd, and we're actually testing less people yesterday than we tested 12 days ago, which I would argue is a spectacular failure. What would you call it?
So we know that testing is really important, and so we have been working hard to ramp up the testing capacity in the country.
Yeah, I don't want to hear about your ramping up, though, Care Minister. With respect, you're not ramping it up. I've just told you you've done 18,000 yesterday, and that is less than you did 12 days ago. So when you keep saying you're ramping things up, actually, you're not. You're going backwards. Do you see?
So we have trebled the amount of tests that we can do since the beginning.
You're not doing them.
People can't get to them.
You're doing 18,000 a day, which is less than you were doing 12 days ago.
Well, if you'll let me finish speaking,
you're answering different questions. You keep talking about capacity. I'm asking you how many you've done.
I'm giving you the context and explaining both sides of the equation. One, I won't say it again because you will probably interrupt me, is access, is the capacity, and the other is the access to tests, and increasing the number of people who are eligible to come forward and get that testing. So we started off with patients in hospital and then NHS workers. We extended it to those working in social care, and that's those in care homes and those providing domiciliary care. I'm looking at whether we can extend testing to personal assistants who are employed by people who pay through direct payments. And we're also extending it to other key workers. So, for instance,
you should have been doing all this weeks ago, with respect, Care Minister. And the fact you're still doing less yesterday than 12 days ago shows me this 100,000 figure was just plucked out of the air and is complete nonsense. Let's turn to the number of people who've died from COVID-19 in this country. How many is it?
So we've now seen just over 17,000 deaths in hospital, and the ONS told us yesterday that they have a figure of 1,043 who've died in care homes.
So you think it's about what, 18,500, 19,000?
So I think we probably have seen more people than that die in care homes, and I hope that.
How many? You're the Care Minister. How many more have died than the government figures?
So next week, I hope that we will be able to publish figures specifically.
I don't want to wait a week. I want you to tell me as Chairman. We had this conversation last week and you didn't know then. You've had a week, so you keep saying next week. Now, I'd rather concentrate on the now. How many more people do you believe, as Care Minister, have died in care homes than the government's official figures?
So the situation with the data that we have at the moment for deaths of people in care homes is it includes some who have died in hospitals. So it's an inaccurate figure and would be misleading because of that double counting. So what we're doing is we've started a change in the way that we collect the data, so that we will be able next week to publish a specific figure for people who specifically died in care homes.
The Financial Times has a specific figure today. The Financial Times says it's over 41,000.
That's not a figure that I recognise, and I think that probably suggests one of the problems with using data that isn't necessarily accurate and hasn't been validated. And I think it's really important.
So you're saying the Financial Times, who've done a very detailed analysis of this, which I suggest you read, that the Financial Times has made this up?
That's not a figure that I recognise in the slightest.
No, I know you don't, because you don't know how many have died. It's hard to recognise it when you've no idea what the number is, isn't it?
So what I said is we will come next week and we will publish the figures.
You said
so
this last week, Care Minister. I mean, you come back on this programme after what many thought was a train wreck interview last week because you didn't know these numbers, and you still don't know, and you're still saying, I'll come back next week. At what point do you come back and actually have an answer? The reality is, if you study the FT piece, which you should, you're the Care Minister, you should have been aware of this and read it all, you would see that there's a very good reason to believe that it's over 41,000 people, including thousands and thousands in care homes. That's the reality. And that is your purview. That is your job, is to know this stuff. And I find it, frankly, I've said this to you before, I find it incredibly insulting that the Care Minister has no idea how many people are dying in our care homes. These are elderly, vulnerable people dying of COVID-19, and you are not taking their deaths seriously enough. People who die in hospitals are getting treated with more respect than people that die in care homes.
So that's an incredibly unreasonable accusation. I take every single death extremely serious. I would wish that nobody would die, but the fact is that this is a horrid virus, and we know that those who are in care homes are amongst the most vulnerable.
What mistakes has your government made?
Well, I think we did have a generic plan for a pandemic virus like flu. In terms of preparedness, we did have a lot of stocks. I think what's fair to say is that they were not getting distributed around the country as quickly as we would like. We also continue to procure, but also we recognise that we will need more PPE in the future, having distributed.
Okay, just to clarify, though, the question I asked you was in the spirit of Emmanuel Macron admitting to a series of errors in preparedness. What errors in preparedness are you prepared to admit on behalf of the British government?
Well, I've just flagged that I think we have a plan which is largely being well followed.
You've told me you have a plan, but the plan has left. The plan, with respect to you, Ms. Coffey, the plan can be any plan you like, but the plan has left NHS frontline workers chronically short for much of this crisis so far of the right PPE. We know it has left care workers chronically short as we speak now of the right PPE. We know that we had nowhere near. Well, let me finish. Let me finish. No, I haven't finished my question yet. We know that we had nowhere near enough testing, and now Sir Patrick Vallance, who's the Chief Scientific Officer, says that has been a problem and we need to ramp up the testing, and that's become crucial. We know that we had not enough ventilators. We were begging other countries like America for ventilators. When you say that we had a plan and you're not prepared to admit any mistakes in that plan, I say that is clearly, self-evidently ridiculous.
Piers, as I say, we have a plan. We're conscious we have more ventilators than is currently needed. So there are some spare ventilators, but we know that we need more. That's why we opened up the ventilator strategy. It's why that ventilators are being designed and are being tested right now. But patients across the country and the public won't want ventilators that don't work. So we need to make sure that they have been tested accordingly. We don't want care workers going into care homes today. We don't want care workers going into care homes today without the right PPE. The reason why they haven't got it, many think, many critics of the government think, and I would be one of those, is that we had such a complacent attitude to this that while other countries were locking down and preparing properly, we were sending hundreds of thousands of people out to the Cheltenham Festival, out to football matches, out to pop concerts. That's why we're so badly prepared, because we spent weeks refusing to accept the severity of this crisis. So, Piers, coming back to the plan, as I said, we had a lot of equipment.
Your plan didn't work, did it, Ms. Coffey? You can keep telling me about your plan. Your plan singularly didn't work. That is why we still have PPE shortages. That is why we are only doing a tiny fraction of the tests we need to do. You keep just saying you had this plan. The plan didn't work, did it?
Piers, the plan is being rolled out. We are seeing the acceleration of elements like testing, the 5-pillar strategy that was there. But coming back to the original plan, there was PPE equipment. It wasn't being delivered efficiently. So we recognise that. That's why we brought in the armed forces to help with that distribution. We're now having daily deliveries around the country in a way that wasn't happening originally. So conscious that while we had aspects of equipment, wasn't getting to the front line quickly enough.
Why
How many NHS staff?
Why isn't
That is now
PPE getting
happening
to
on a
care
daily
workers?
basis.
Why isn't PPE getting to care workers in care homes? You've already said there's a differential system in terms of counting the numbers who are dying in care homes. People feel like they're being treated entirely differently in the care sector than in the NHS. We were given an example this morning that care homes, in one example, paying £8,000 a week for PPE and being charged VAT on that. Now, they say VAT is not charged when PPE is ordered into the NHS, but it is into the care sector. Why have we got a two-tier system when you keep repeating the mantra, we are trying to save lives?
So about 8 million pieces of PPE have been delivered to 26,000 care settings across the country, whether that's care homes, hospices or home care providers. Specifically on VAT,
the numbers don't matter
Susanna,
if care homes individually feel like they're not getting those pieces of equipment. And why are you charging VAT to the care sector on PPE?
So I think for the care sector, the VAT issue, to be open with you, is they can reclaim the VAT. I think in essence, they won't pay any VAT on it ultimately. So I don't think that's a particular issue.
Well, why charge them? Why charge them VAT?
Think...
Why don't you just do what you've done with the NHS and remove VAT from all PPE for all care homes right now on this programme? Just do the right thing.
So VAT is not an issue when it comes to procurement of
VAT
PPE.
is an issue because we've just literally spoken 1 hour ago to the people running care homes in this country who don't understand why you're charging VAT on PPE for care homes when you've removed it from the NHS. Why?
So VAT can be reclaimed by all those care homes in their purchases, and so that's...
So why bother charging it? Remove the process. They don't have time to fill in forms.
The care homes
Ms. Coffey,
that you are...
if you're saying they're all going to get it back, remove it right now. Stop them doing unnecessary paperwork. Let them do what they're supposed to do, save lives.
The important thing, Piers, is that people can go to wholesalers, get PPE. They can also benefit from deliveries which are being made to care homes. This is all being done on clinical need. It is being distributed, and we are increasing the production, but also the testing of PPE. So whether that's businesses like Burberry's having to go through the testing process to make sure the gowns that they are committed to producing will actually be valid for use.
Do you know how many care workers? Do you know how many care workers have died of coronavirus or are currently seriously ill with it?
I don't know the answer to that.
Do you know how many NHS workers have died from coronavirus?
I don't have the answer to that. I know that.
How can you? I'm not being funny, but
I know.
Sorry, how can a member of the British government sent out to talk to the media have literally no idea how many NHS workers or care workers have died? Let me give you a bit of help. Here's the front page of today's Daily Mirror. Has the pictures of all the NHS workers who've died. Why don't you know this stuff? Matt Hancock didn't know how many NHS workers had died the other day. Why is it the journalists seem to know more than you do about how many people are dying on the front line of this?
But I do know that over 11,000 people have died, very sad deaths across the country. I do know that we are prioritising the clinical need assessments of those people, particularly in hospitals, but also in a social care setting. This has been at the forefront of the Department of Health's ministerial team from the very start. But understandably, the people who have not only have demonstrated symptoms, but continue symptoms requiring to go to hospital has been the top priority alongside frontline clinical staff, but also social care staff can.
It's quite hard to prepare people properly if you don't, with respect, Ms. Coffey, if you don't know how many people are dying in care homes, you don't know how many health workers are dying. Quite hard to prepare and protect them properly if you have no idea of the scale of what you're dealing with. We have never seen this kind of carnage wreaking havoc on the lives of our health workers and care workers. And the least I expect is that the government knows how many of these people are dying. Shouldn't be too much to ask.
Piers, the number of deaths outside of hospitals is being registered weekly. That is being declared.
Okay, how many people have died? How many? Okay,
that continues.
All right,
the ONS will be publishing its latest update today.
How many people have died of coronavirus in care homes or at home?
Well, my understanding is that the latest figures will be issued today. I don't see the point of me doing something that's over a week old, and that information will be out later today.
So you have no idea?
My understanding is it's about 1,000. but more information will be published today